are going to discuss the topic hemostasis. Before I start, I want to tell you, don't get confused with the term homeostasis. Homeostasis basically is a phenomenon by which equilibrium is maintained in the body, but hemostasis is defined as arrest of bleeding. Okay. Now, if you have any cut or any injury, hemostasis is achieved by 4 different steps. The first one is vascular constriction. Second is formation of platelet plug. Third is formation of blood clot. And finally, eventual growth of the fibrous tissue into the blood clot. Coming to the first step, that is vasoconstriction. So what exactly happens? So when your vessels, if you have a cut in your skin, directly your blood vessels under it get injured, right? So when the blood vessels get injured, 3 things happen. First, the nerve endings release vasoconstrictors. Okay? And also, nerve reflexes are initiated by pain impulse. Secondly, the smooth muscles also contract. And the endothelial lining, they release nitrous oxides, prostaglandins, thromboxane, which again causes vasoconstriction. So vasoconstriction occurs by these 3 phenomena. How does the formation of platelet plug takes place? Now imagine this is your blood vessels. Okay. Now when there is any injury, there is rupture in this wall of the vessel, right? So now what happens? Now see, vessels are made up of different layers. So the collagen gets exposed. Now what happens when there is when this collagen gets exposed, there is release of a factor known as the von Willebrand factor. Okay. Now the platelets which are present in the blood comes in contact with this von Willebrand factor and gets attached. Now when this platelet comes in contact with the collagen, with the help of von Willebrand factor, it releases many contractile proteins and other substances which help in other platelets to get attracted and to get attached to these platelets. So this way there is platelet aggregation. And finally, it forms a plug. This is known as platelet plug formation. Now we have a platelet plug, but this platelet plug is not strong enough to hold on to all the blood that might ooze out. So a clot formation is very necessary. So you might have heard of the coagulation pathway, which is very important from the exam point of view. Now, coagulation pathway occurs in 2 pathways, okay, through the intrinsic and through the extrinsic pathway. We discuss the pathways. It is very important for you to know the clotting factors. So factor 1 is fibrinogen, 2 is prothrombin, 3 is tissue thromboplastin, 4 is calcium ion, 5 is labile factor. There is no clotting factor 6, 7 is stable factor, 8 is anti-hemophilic factor, factor 9 is Christmas factor, factor 10 is Stewart power factor, 11 is plasma thromboplastin antecedent, 12 is Higman factor, and 13 is fibrin stabilizing factor. Factor 4, factor 7, factor 8, factor 9 and factor 12, the name of these factors are very important from your exam point of view, because this plays a very important role in the coagulation pathway, plus this can also come as MCQs. So the intrinsic pathway gets activated inside the blood vessel, and extrinsic pathway gets activated outside the blood vessels because of tissue injury. So in intrinsic pathway, the factor 12 gets converted into factor activated 12, and now this activated factor 12 will convert factor 11 into activated factor 11. Now imagine these were sleeping, okay, so someone will nudge them, and now that this friend has woken up, he will wake up his other friends also. So now the factor 12 has got activated, it will activate factor 11 also. Factor 11 with the help of phospholipids, calcium and factor 8 will go and activate factor 9 also, and factor 9 will also activate factor 10. Now this activated factor 10 will convert prothrombin into thrombin. Now this thrombin helps fibrinogen to get converted into fibrin. Okay. Now this is the intrinsic pathway. Now the extrinsic pathway gets activated with the help of tissue factor, as I had said. So factor 7 gets converted into activated factor 7 with the help of this tissue factors. Now the extrinsic pathway is way faster than the intrinsic pathway. You can see it very well. In intrinsic pathway there are so many steps, but in extrinsic pathway this activated factor 7 goes and directly activates either factor 9 or directly activates factor 10. So that's why extrinsic pathway is way faster. And now that fibrinogen has got converted into fibrin monomer, there is cross-linking of this fibrin monomer, and finally there is formation of clot. And there is a constant positive feedback going on, where the clot initiates a positive feedback to promote more clotting. Final step of hemostasis is the clot retraction and expression of serum. So how does this happen? So now we know how the clot got formed, right? So after around 60 seconds, this clot contracts, okay, and it expresses a fluid known as serum. Now, because as the clot contracts, the fibrin meshwork and the clot turns into a small mass, and hence the edges of the blood vessels are pulled together now. Now see, imagine this is the break in the blood vessel. There was formation of this clot. Now this clot becomes small in size. So now that the clot contracts and becomes small in size, it pulls the blood vessels towards each other. Now this is how the blood vessels come in contact and healing takes place. Now some of the clinical applications that you can also mention in your answer is that factor 8 deficiency causes hemophilia A, factor 9 deficiency causes hemophilia B, and when there is a deficit or decrease in von Willebrand factor, it causes von Willebrand disease. In all of these diseases, you can see very increased bleeding, and if there is any injury or any surgery done, you can see that there is increased chance of bleeding. So now, if you want to write an answer on hemostasis, you should start it with the definition, and then you should briefly describe about platelets and write about the 3 steps of hemostasis, that is your vasoconstriction, platelet plug formation and clot formation. Describe these 2 steps in detail, and when you are writing about clot formation, first write about the clotting factors, then mention about the coagulation pathway, the extrinsic pathway and the intrinsic pathway. Then also write about the clot retraction, and finally write about the clinical application. So when you write all these things in a very systematic manner, this will make your answers stand out. Draw platelets diagram, make flowcharts, and try to describe whatever you know about it. This is how you can write a very perfect answer for clotting or hemostasis. Thank you.